Hello everyone, welcome to Pediatrics by Dr. Anand. Let's finish this class. Reflexes, important reflexes. So we have this Muru reflex. When does Muru disappear? Muru disappears by 6 months. There is one more reflex which disappears by 6 months, that is ATNR, asymmetric tonic neck reflex, which is also known as bow and arrow reflex. That also disappears by 6 months. You know Muru, right? When you suspend the baby down, बच्चे का सर नीचे करते हैं तो बेबी क्या करता है? He has opening of hands, abduction, then adduction, and then cry. Opening of hands, abduction, adduction, cry. Okay, that you should know. In fetus, swallowing reflex appears by 16 weeks. Okay, fine. Muru disappears by 6 months and ATNR disappears by 6 months. That is what you called, that is an exam question. Persistence of Muru reflex beyond 6 months is cerebral damage. That you should know. Where do you see exaggerated Muru and absent Muru? Exaggerated Muru, it is seen in HIE stage 1, and absent Muru, it is seen in Down syndrome, kernicterus, and stage 3 HIE. So HIE stage 1 exaggerated Muru, HIE stage 3 absent Muru. What are the conditions? You see asymmetric Muru reflex. Asymmetric Muru you see in fracture clavicle, Erb's palsy, Klumpke's paralysis. And remember, Erb's palsy will have a policeman's tip. Erb's palsy, बच्चे का हाथ कैसा हो जाता? Policeman's tip जैसा, like a internally rotated policeman's tip head. Policeman's tip. Parachute reflex. When does parachute disappears? Parachute reflex disappears by 8 months. Some book says 10 months. So parachute reflex disappears by 10 months. Parachute reflex appears by 8 to 10 months and never disappears. Parachute, बच्चे को उल्टा करके जब नीचे करते हैं तो बच्चा हाथ ऐसे कर लेता है. Once I put the baby from upside down like that, he put his hand like this, known as parachute reflex, which comes later in life. जो बाद में आता है. कब आता है? It comes by 8 to 10 months, and once it comes, it never disappears. That you should know. One more reflex which comes later in life, that is symmetric tonic neck reflex, which comes by 4 to 6 months. You can simply remember Muru disappears by 6 months and the symmetric tonic neck reflex appears by 6 months. That's it. So we have this various developmental assessment techniques. We have Denver developmental scale, we have Baroda scale, Trivandrum scale, and we have this DASI, that is developmental assessment scale for Indian infants. Developmental assessment scale for Indian infants. But they don't ask question from that. These are just the scales we use. Developmental के बच्चे का DQ कितना है, कितना होता normal DQ? The normal DQ is around 100. The normal DQ is you and me, that is 100. Developmental quotient is equal to developmental age upon actual age into 100. Developmental quotient is equal to developmental age upon actual age into 100. Child's participation in decision making process about their health care is termed assent. This एक question आया था, what is assent? Assent is the child participation in decision making process is known as assent. What is BFHI? BFHI is Baby Friendly Hospital Initiative. Baby Friendly Hospital Initiative, BFHI, where they promote about breastfeeding and everything. So BFHI was launched by WHO. What is the IMNCI full form? Integrated Management of Neonatal and Childhood Illnesses. Integrated Management of Neonatal and Childhood Illnesses. They give this category, okay? Pink category, yellow category, and green category. Pink means severity, urgent, severe dehydration, shock patient. So urgent, pink category means urgent hospitalization. Yellow category means kind of a yeah, exactly, specific medical treatment. And green is good to go, always home management, that you should know. And yellow will be like you can admit the child if you want, like a OPD basis or a 1 day basis, whereas pink, so it's like severe urgent hospitalization. Okay, preschoolers are most likely to view illness as punishment of misdeeds. Preschoolers are most likely they view illnesses as punishment of misdeeds. बुरे कर्म किए हैं तो बीमार पड़े हैं, ऐसा प्री स्कूल बच्चे सोचते हैं. Separation anxiety is more common in older infant. Separation anxiety is more common in older infant. Parallel play. You play yours, I'll play mine, but we'll be playing together. मतलब I'll play mine, you play yours, but will not fight. मैं अपना खेल रहा हूँ, तुम अपना खेलो, शांति से अपना अपना खेलते हैं. Parallel play. It's seen in 1 to 3 year is a toddler. yes, इसमें देखा जाता है. Onlooker play. What is onlooker play? Is a behavior in which a child is not involved in any kind of play. Onlooker play is just looking, but he is not participating in anything. Play for preschool child is necessary for emotional development. That's so nice. Play for a preschool child is very nice for the emotional development. According to Erickson's psychosocial developmental theory, personality develops in order of 8 stages. We have 8 stages of personality development. According to this Erickson's psychosocial developmental theory, trust or mistrust develops by 0 to 1 year, followed by autonomy or versus shame by 1 to 3 years. So 0 to 1 year develops trust or mistrust. 1 to 3 year develops either shame or either autonomy. Initiative versus guilt. Initiative versus guilt happens in 3 to 6, and 6 to 12 we have industry versus inferiority. Industry versus inferiority. So I'll repeat again. Trust versus mistrust, 0 to 1 year. Autonomy versus shame, 1 to 3. 3 to 6 year we have initiative versus guilt, and 6 to 12 year we have industry versus inferiority. These are the Erickson's psychosocial developmental theory. National Pediatrics AIDS Initiative was launched on 30th November 2006. National Pediatrics AIDS Initiative was launched in 30th November 2006. According to the hospital's protocol during emergency situation, code pink is used for infant and child abduction. Code pink is used for infant and child abduction. Code pink. Scoliosis is a 3-dimensional spinal deformity that usually involves the lateral curvature. You know, forward bending of spine and lateral bending of spine. Forward bending of spine is kyphosis, and lateral bending of spine is nothing but scoliosis, and it is surgically treated. You have to surgically treat that, the scoliosis. Measles rash starts behind the ear. It's an MCQ. 3C we ask in the OPD: cough, coryza and conjunctivitis, and that too purulent conjunctivitis. Do you have cough? Yes, doctor. Do you have coryza, means running nose? Yes, sir, we have. And do you have a purulent sticky discharge with conjunctivitis? Yes. And the opposite to the first and second molar, we have this white dots known as Koplik spots, which is the most common complication of measles. The most common complication of measles is otitis media, but the most common cause of death in measles is pneumonia. Otitis media is the most common complication. ASD is never found in measles. You will not see a atrial septal defect or a heart problem. What is congenital syphilis triad? It is Hutchinson's triad, which is nothing but Hutchinson's teeth, interstitial keratitis, and 8-nerve deafness. Kangaroo mother care is a technique used in preterm, premature baby. We basically provide. Iska mnemonic is C. C is the MCQ. S for skin to skin contact. E for exclusive breastfeeding. And what is the benefit of that? Early discharge will happen. Skin to skin contact, exclusive breastfeeding, and early discharge. Which babies I should start? It is done baby 1.8 kg, basically 1.8 kg you can start KMC. When should you stop KMC? Till the baby is 2.5 kg you should after like 2.5 you should stop KMC. If the child is less than 1.8 kg, usually if he is hemodynamically stable you can give KMC, otherwise 1.8 kg is the ideal weight. Okay, and yeah, babies who are in KMC, they have less prone for apnea and bradycardia. Okay, that's nice. When do you celebrate breastfeeding week? We celebrate breastfeeding week in the first week of August. How much is calories? So breast milk contains 65 kilocalories and 1.1 gram of protein. So basically if I talk about the protein, it is 1.1 gram. If we talk about the calories, it is 65 grams. And very importantly, how much is lactose? How much is lactose in breast milk? It is 7.4 gram. Number one. Number two, if you talk about cow's milk, calories is 67, protein is 3.1, and lactose is 4.7. 7.4, 4.7, 1.1, 3.1, 65, 67. These are like so many MCQs, you have no idea. that you should know. Okay, what else? Yeah, that's it. Supplementary suckling technique can be used as a strategy to initiate relactation in mothers who have developed lactation failure. क्या होता है, बच्चे को माँ के दूध से लगाते हैं छाती से, लेकिन माँ के निप्पल से एक पाइप अटैच होती है, अलग से दूध एक कटोरी में होता है, तो बच्चा पी रहा होता है, सक जब करता है उसको लगता है वो निप्पल से, माँ के निप्पल से दूध आ रहा है, पर निप्पल से नहीं आ रहा होता, वो वहाँ से गिलास से आ रहा होता है दूध. तो दैट इज लाइक सप्लीमेंट्री suckling technique where the milk is coming from the plastic cup, not from exactly from the mother. Okay, pediatric drug calculation. Yeah, this is the last segment. Pediatric drug calculation. I have this beautiful formula I want to show you. So pediatric drug calculation, we have this formula which I'll show. Yes, so we have this young rule. Okay, where there are three things. One is young rule. Young rule basically it is for children aged more than 1 year. What is the formula? It is the, for example, the child dose is equal to age in years upon age plus 12 into adult dose. For example, I have a 4-year-old child. उसका मुझे वो निकालना है, I have to calculate, and the adult dose is 500 mg. The child is 4-year-old and the same drug, the adult dosage is 500 mg. So this 4-year-old child, how much should I give? The formula is age in years, that is child age is 4, upon age in years again plus 12. So 4 by 4 plus 12 into 500, that is the adult dose. So that comes 125 mg. So something, if a drug I am giving to an adult is 500 mg, the dose for a 4-year-old child will be 125 mg. That is what, Young's rule basically, it is based on the age. Young rule is based on the age and Clark rule is based on the weight. Young rule is based on the age and Clark rule is based on the weight, and Young rule is age in years upon age plus 12 into adult dose. What is Clark rule? Clark is according to the weight basically. So the dose will be weight in pounds upon 150 into adult dose. Weight in pounds upon 150 into adult dose. This is for any child. For example, again same, we are giving a drug to an adult. That drug is 600 mg we are giving to an adult. I have a 15 kg baby. How much should I give the same drug? So it will be like in pounds, 15 kg is 33 pounds. So 33 by 150. Weight in pounds by 150. So 33 by 150 into adult dose. So adult dose will be in milligram. So yeah, so that's for 600. So yeah, so that's what. So then the answer will come. Okay. Next we have is very importantly, yes, what is Fried rule? Fried rule is for less than 1 year. Remember, Young rule is for more than 1 year child. Young rule is for more than 1 year, and for less than 1 rule, very importantly, we have the Fried rule. We have the Fried rule for less than 1 year. It is age in months upon 150 into adult dose. Age in months upon 150 into adult dose. For example, we have a 6-month child and we have to calculate the dose. Adult dose, we are गिविंग अ ड्रग एडल्ट डोज 400 mg. तो 6 महीने के बच्चे को कितने mg बनता है? अगर एक एडल्ट को हम 400 mg दे रहे हैं तो 6 महीने के बच्चे को कितने mg देंगे? सो इट विल बी लाइक एज इन मंथ्स, दैट इज 6 डिवाइड बाय 150 इंटू 400, दैट इज एडल्ट डोज. सो वो आ जाएगा. That's it. So that is a simple mnemonic. Okay, young children, young के लिए like Clark rule is based on the weight, Fried rule is based on the months, and Young rules is is based on the years. Okay, Young rule is based on the years, Clark rule is based on the weight, and Fried rule is based on the months. That you should know. That's it. ये तीनों हो गए हैं खत्म. So that's it. That finishes this part. Thank you so much everyone. Such a beautiful revision. That finishes everything. That finishes such an important part. I hope you guys have understood. That finishes the whole segment of this class. Thank you so much for all the love and support, and that finishes this class. Always remember, what is the take home message? क्या याद रखना है before opening the CBT, before opening the computer based test or any test in your life? 5 deep inspirations, hold the breath, and deep expirations. Do it right now with me. Just do one with me. Start. Do a proper breathing. So it's like 1, 2, 3, 4, 5. Inhale, hold the breath for 2 seconds. 1 and 2, and then totally exhale. So once you do that 5 times proper, before opening any CBT, any test, you should do that. Your heart will relax down एंड यू विल परफॉर्म बेटर. ओके, तो थैंक यू सो मच एवरीवन. जाने से पहले क्या है ख्याल, वो कहते हैं ना, बड़ी अच्छी सी कविता थी. तो दोस्तों, शहर की इस दौड़ में दौड़ के करना क्या है, अगर यही जीना है दोस्तों तो फिर मरना क्या है. पहली बारिश में ट्रेन लेट होने की फिक्र है, भूल गए भीगते हुए टहलना क्या है. सीरियल के किरदारों का सारा हाल है मालूम, पर माँ का हाल पूछने की फुर्सत कहाँ है. अब रेत पे नंगे पाँव टहलते क्यों नहीं, 108 है चैनल पर दिल बहलते क्यों नहीं. इंटरनेट से दुनिया से तो टच में है, पर पड़ोस में कौन रहता है जानते तक नहीं. मोबाइल लैंडलाइन सबकी भरमार है, लेकिन जिगरी दोस्त तक पहुँचे ऐसे तार कहाँ है. कब डूबते हुए सूरज को देखा था याद है, कब छाना था कि शाम का गुजरना क्या है. तो दोस्तों, शहर की इस दौड़ में दौड़ के करना क्या है, अगर यही जीना है दोस्तों तो फिर मरना क्या है. ओके, थैंक यू सो मच एवरीवन. प्लीज टेक केयर एंड ओके, एनी अदर कमेंट. अच्छा, गाना सुनाओ, सब गाना सुनाओ, शायरी सुनाओ, सब सब सुना दूं मैं खड़े खड़े यहाँ पे. गाना गाना गाना. ओके, कौन सा सुनाए. ओके, ऑलवेज सिंग दैट सॉन्ग व्हेन यू आर स्कैर्ड, सिंग दैट सॉन्ग. हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन. हो मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. That's it. So please take care and thank you.